Ugandan scientists undertook a study for the use of convalescent plasma, that is blood donated by people who have recovered from COVID-19, to see whether it's viable for the treatment of the disease. The Minister of Health, Dr. Ruth Aceng, has now launched and approved the clinical trial of the use of convalescent plasma for the treatment of COVID-19 in the country.
COVID-19 has no treatment. What is given currently is supportive. So having convalescent plasma come on board is great, and we are looking forward to it being started tomorrow. Can you start the clinical trial tomorrow? You can see that we are losing 2 to 3 patients per day. We started from 1. Ugandans thought it was a joke. The numbers are climbing up every day. We have now gone to 3 per day. We need more innovations, because soon it will be 10 per day, 20 per day. COVID is real. COVID is with us, and it can take any of us.
Currently, there is no vaccine available for COVID-19, and the treatment is only starting to emerge. Plasma is a clear, straw-colored liquid portion of blood that remains after red blood cells, white blood cells, platelets, and other cellular components of blood are removed.
Now, what we are doing is we are getting these antibodies from healed people and give them to this person who have not yet made his own antibodies and neutralize the virus in real time. And where some studies have been done, there is dramatic improvement in symptoms when these antibodies are given. So you neutralize the virus in real time. So that's the science we are trying to do. The other way to make people get antibodies is actually through immunization, vaccination. We introduce a bit of the virus or part of it, so you can make antibodies in your body to keep when you get an infection. So for this,
the minister applauded the donors and also called upon other recovered COVID-19 patients to come in big numbers to donate plasma.
So I want to appeal to all the over 4,700 people, please come and donate. Give us plasma so that we can treat patients when we have them.
Dr. Ruth Aceng appealed to the public to observe the standard operating procedures put in place by the Ministry of Health to contain COVID-19.
Right now, we are at phase 4. Phase 4 means widespread community transmission. So all the efforts of Ministry of Health is geared towards mitigation. We can no longer control, we can only mitigate. And part of the mitigation is use of convalescent plasma. So protect yourselves. Adhere to the standard operating procedures. Wear your masks, wash your hands, sanitize, and maintain your social distancing.
Professor William Bazeo, the principal investigator of the project, says that Makerere University has the capacity for life-changing research and innovations for all conditions.
And we had a strategy and said, let's now use those who have recovered, safeguard all those that are getting sick. That's the reason why we started working on the plasma treatment. It has taken a bit of time, but we had to be very sure and thorough that what we get out and we start using on patients will work and will not fail.
Scientists say that there is emerging evidence to support the use of convalescent plasma for the treatment of COVID-19, especially among severe and critical. Zahara Bigaba, UBC.